I see it's 1:17. So welcome. I'm Tim Steinhauer. I'm the superintendent of the Mount Lebanon School District. And presenting with me today, we have Dr. Ronald Davis, who's our assistant superintendent for secondary education, and Dr. Mary Beth Irvin, who is our superintendent for elementary education. We also have Deanna Hess available, and Dr. Heather Doyle will also be joining us when we get to her part of the presentation. So we appreciate you taking the time out of your afternoon to visit with us and to again get more information about both the health and safety plan and the reopening education plan. We've been presenting this updates as we've moved along for the last couple weeks. 2 weeks ago, the school board did discuss the health and safety plan. Prior to that, the board did review and approve a athletic and activities health and safety plan. And the board did approve the school district's health and safety plan last night. And Dr. Davis will be very clear in how he describes what the health and safety plan is. And again, our health and safety plan is specifically if and when our children ever return to this building, we are required by the Pennsylvania Department of Education to submit a plan that addresses the health and safety concerns for things such as masks and physical distancing and sanitation. And then the second part of our afternoon will be Dr. Irvin explaining what our reopening education plan is. And we've been very purposeful about delineating between the two different plans. The health and safety plan that Dr. Davis will review does not dictate how children will return to school or how learning will resume. It does not identify the mode of instruction that will occur. Dr. Irvin will describe the reopening education plan that does include multiple options and multiple avenues and multiple modes of how instruction could occur in the school district. And the school board will approve the reopening education plan on or before August 17th. So stay tuned to us for that. So I would like to turn it over to Dr. Davis and Dr. Irvin, and they'll share with you the updates that we've made to the health and safety plan that were approved last night. And then Dr. Irvin will go into more depth about the reopening education plan.
Thank you, Dr. Steinhauer, and good afternoon to all of the parents tuning in this afternoon. Just so we're clear and with your expectations, this presentation is a repeat of last night's presentations. So this is so in case you weren't able to tune in last night to see the presentation that Dr. Irvin and I provided. This afternoon, we're doing a repeat of last night's presentation. So if you've seen it last night, you're going to see some very similar or hear some very similar information. And before I jump into the updated health and safety plan, I just want to address real quick, particularly for our high school parents, the email that just went out this afternoon from our athletic director, Mr. Grogan. We have a health and safety plan that's related to athletics and activities. Our board approved it in late June, and we've been operating under that health and safety plan for athletics and activities since then. Well, we were notified last night that one of our students participating in our summer workouts, particularly our boys soccer summer workouts, was positively diagnosed with COVID-19. So the student has not been on campus since July 21st. And I guess I went for a test on July 23rd, and the results came back, and they are positive. So as soon as the district was aware, we've sent out a communication today, particularly to our high school families. But really, it's the families that have been involved in our summer workouts with our soccer team. And obviously, we know that there's a lot of interconnections in our community between families. So we wanted to make sure that all families were aware that we had a student that tested positive. For obvious confidential reasons, we're not in a position to talk about who that student was or which family it was. But our letter that went out to our high school families does talk about the signs and symptoms of COVID-19. And should your child be experiencing any of those symptoms, you should be reaching out to your healthcare provider as soon as possible. So I wanted to make sure everyone was aware that went out this afternoon. I guess it was earlier this morning that it went out. All right, so let me transition over to the presentation. As Dr. Steinhauer had indicated, the board did approve the health and safety plan last night, but the health and safety plan that we currently have on the website is a redlined version, so that our families are aware of what the conversation was like on July 15th with the school board, and then the modifications that were made to the document since July 15th. After today's presentation, we'll take the redlined version down, and then we'll certainly put up the final version for our community to be aware of. And that's the approach that I take this afternoon with this presentation, is really just giving you the comparisons between the July 15th presentation or the July 15th document in our current document. So it's really, I'll be addressing the things that are highlighted in red throughout the presentation. Mr. Stengel, if you'd be so kind. As Dr. Steinhauer had indicated, I want to be clear about the purpose of the Pennsylvania Department of Education Health and Safety Plan. In that, number one, it is a requirement of the Pennsylvania Department of Education that we complete this document. It was a template that was provided to us from the Pennsylvania Department of Education, and there were options in there that we had a choice of to declare back to the Pennsylvania Department of Education. As Dr. Steinhauer indicated, and it's worth repeating, this document is not the indicator of what mode of instruction or type of instruction will occur in our buildings. It is only required to be approved by the Board of School Directors to allow in-person instruction to occur inside our districts. So with the approval last night, we do have the authority now, according to our school board, in the completion and submission of this plan, to allow for in-person instruction in our buildings, aligning to this health and safety plan, should the Board of School Directors so choose to do that. As you can see on this document, there are two red arrows. When we presented the plan on July 15th, we talked about this plan being a total reopen for all students. And some of the feedback that we've received from the community since that July 15th is we recognize that solely identifying that indicator created some confusion, because our health and safety plan and our reopening education plans that Dr. Irvin will talk about has always considered multiple options. It did consider blended reopening. It did consider total remote options for families. So we thought it was more clear for our community if we have the health and safety plan reflect all of the options that it can address. So we have done that, and that's how the plan will be submitted. And this plan is really designed to allow us to adjust as needed as the conditions warrant inside our community or inside the school district to make sure that we're providing a healthy and safe education for all of our students. Mr. Stengel? Again, staying by that this is a redline version of the presentation. We want to make sure that the community continues to be aware of the guidance documents that we're reviewing to make the edits and adjustments to our plan. So there are two additional hyperlinks as part of this presentation. They are also included in the plan that's online. In the one that it has been most significant in the revision to the plan is the public health guidance that was provided from the Pennsylvania Department of Health in consultation with the Pennsylvania Department of Education. It's the next to the last bullet there on the slide. So that was most informative to the changes that you'll see between the two documents. And the other reason that I want to kind of revisit this slide is it's an opportunity for the district to say thanks one more time to the hundreds of people that have been involved in the development of this plan, and the input that has been provided into the plan, and the feedback that we've received about the plan. There's a lot of work that went into this by a lot of people, starting in late April, early May, making sure that the committee, the steering committee, and the subcommittees that worked all the way through the middle of June, that they had a clear understanding of the guidance, so that as they're providing input and shaping the plan, that we're using the information, the best information available that was provided to us. It is intended to be a guidance document, and what will happen now is that as the plan is now approved, our building principals are beginning to take the guidance that's in these documents and overlay it into the context of their specific buildings. Mr. Stengel, if you'd be so kind. Thank you. Again, this slide was part of our July 15th presentation, and we wanted to bring it forward again one more time to reassure the community that we have had medical experts review our plan and make contributions into the plan. I know she's with us today, and we can't thank her enough. Our chairperson for Health Services, Mrs. Hess, she has been instrumental from the beginning in helping us kind of understand the medical side of this and the guidance that's coming out from the health department, whether it's the Pennsylvania Department of Health or the Allegheny County Department of Health. And she is our direct liaison when we have questions or concerns to the Allegheny County Department of Health and gets us great answers. So certainly she's been instrumental. The health department has played a consultative role and have contributed information into our document. Our school physician has reviewed the plan and has affirmed it, and there is a team from St. Clair Hospital that has reviewed the plan, and I appreciate most that their guidance to us was follow your guidance. You know, certainly they provided some input and information into the plan, but generally they said, you know, you have a lot of great documents to review that provide you guidance on how to build the plan. You should follow that guidance. And so it was great to hear from that team that our strategy was was the direction that they would have provided as well. Mr. Stengel? I've talked about this one a little bit, so I'll move past this slide pretty quick, but it was really the Pennsylvania Department of Health and the Pennsylvania Department of Education that provided us with that updated information and as we're moving forward. So Mr. Stengel, if we can move off to the next one. So some of the major changes inside the plan, I want to start with universal masking. We had provided to the community the Secretary of Health's order from the beginning, that hyperlink, but the revised or the new document that came in, this new hyperlink that's in red, it has really clarified expectations for schools around the Commonwealth that all students and all staff are required, and I'm going to emphasize that word again, required to wear a mask inside the building. Now we know if you read the guidance and read the document, there are some exceptions that are permitted, but they are components of the Section 504, IDEA, or Americans with Disabilities Act. So they all require some type of a doctor's order back to the school that says that this person has a mental health or physical health condition that precludes them from wearing a mask. So there will be some minimal exceptions to the universal masking rule, but they are all under doctor's orders as in accordance with Section 504, IDEA, or ADA as it applies. Mr. Stengel, thank you. Included in that documentation was this idea of mask breaks. And so we've embedded that language into our plan. The mask breaks are permitted when 6 feet of distance exists between the individuals. And there's some examples in here on when that can occur. So we did embed that information into our plan, and our teachers will be using mask breaks accordingly throughout the day. Additionally, the language that's in the new guidance that came out, since one of the exceptions to the mask is when you're eating and drinking, the expectation is that there is 6 feet of distance between students in the cafeterias when they are eating. So I want to make sure the community is aware of that because our cafeterias are going to look different. There's going to be minimal seating inside cafeterias associated with those tables. But it also means that we're going to have to use all available spaces inside our buildings to make sure that we can feed the students that are inside the buildings. There's some other guidance in here about making sure that you're wearing face coverings as you're transitioning, to and from the lunch line, making sure you're using good hygiene practices. But I think the big implication that we want to make sure parents are aware is that you'll see a really de-densified cafeteria unit, and you're going to see students eating in various locations throughout the building throughout the day. Mr. Stengel? We had this slide up last time, and we can't emphasize it enough, is that if you're not feeling well, just stay home. Students and employees should stay home when they are sick. And what you're seeing coming out in the guidance now, both from the Pennsylvania Department of Health, and you're seeing some of it come out from the Center for Disease Control and Prevention, as they're now starting to create these crosswalks between the signs and symptoms of coronavirus and other symptoms like the flu or the common cold or allergies. So that's why they're advising everyone if you're not feeling well, to stay home. Whether, if you're not sure if it's an allergy or a common cold or the flu or COVID-19, just stay home. And that is the most important message that we can give. We are a community, and we all have to be part of the community, and we're all in this together. And the best way that we can help each other is that when we're not feeling well, is to stay home. Additionally, the guidance kind of reminds us about those healthy behaviors. Washing your hands, covering your coughs and your sneeze, avoiding close contact with people that are sick. So always great advice and great guidance. But again, we said it in the last presentation. I've said it 3 times today. If you're not feeling well, stay home. Mr. Stengel. And then the last slide here that I wanted to touch on is we've got a lot of questions about, well, what happens if someone gets sick inside the school? And we've always had an isolation protocol. It was in our July 15th document, and we've embellished it with the new language that came out for our most recent document, responding to a confirmed or probable case. And that's that second bullet there on the screen. Our chairperson for health services for the district or a designee will contact the Allegheny County Health Department. They're going to make a joint determination about any isolation or quarantine needs, and we're going to comply with that recommendation. We made commentary before that each circumstance is different, each situation is unique, and so we will be in close communication with the health department as we address it. Generally speaking, there is clear guidance from the CDC about how you do cleaning protocols. Should there be a situation in a space, whether it be a classroom or an office or a conference room, CDC's guidance is clear. You have to vacate the space, you have to let it sit for 24 hours, and you can clean it, and then you can reoccupy it. So it's about a 48-hour window before you can reoccupy the space. As for the people involved in that space, the practice and the procedures that's been going on with the Allegheny County Health Department so far this summer is they're more interested in close contact. So if you've been within 6 feet of somebody for over 15 minutes or 15 minutes or over, that's the individuals that they're interested in having conversations with and potentially having quarantined or isolating. So it's not necessarily an entire classroom or an entire space. It's not the people that you pass casually in a hallway or walking on the sidewalk. They're really interested in the people that you've been in close contact with. So because each one is a different circumstance, I assure our community that we will, just as we did with this, this situation that came up that I talked about earlier this afternoon with the soccer player, we will be in close contact with the Allegheny County Health Department and take our lead from their guidance. So those are the updates and overviews to this document. And to transition now, I'll turn it back over to Dr. Steinhauer.
Thank you, Dr. Davis. And your presentation was just a little bit different than last night, just based on some of the questions that came up, and even based upon the soccer situation that you were addressing. And it is our intent to communicate just like we did with this soccer situation regarding issues that come up during the year or how things evolve. So we are really trying to be purposeful about giving a lot of information and communicating. We can never give enough. We realize that we are trying our best every day to get information out to you as quickly as we can. And I can attest to the fact that you have the Mount Lebanon administrators and leaders have been working tirelessly because, as you know, this climate evolves quickly, rapidly, daily, almost moment by moment. We are really trying to be responsive to that. So I hope you have confidence in your leadership team, including your building principals, are working really hard. I also wanted to mention again, Ron identified that we had quite a few people help us create these health and safety plan. We had over 100 teachers, support staff, secretaries, our transportation provider, our maintenance people, custodians. We really tried, students, we really tried to get everybody to involved and at least have a voice, and so that they had a glimpse into the ways we were thinking and the strategies we were going to use to help mitigate these situations. So let's transition from the COVID risk side of it to what our main goal is here. Is, you know, we're an educational institution, and it's our job to deliver instruction to our children and to put our teachers in the best possible conditions under which they can deliver that instruction. And I can assure you that our teachers stand ready to deliver instruction in any format which the board ultimately determines, whether that is full in person, whether that is some hybrid type program, or whether that is all online or any mixture in between. We have a teaching staff and principal and administrators who are going to give you their best effort, and they stand ready to address every issue as it comes up. I just want to make clear that everybody is aware that, you know, school will not be like school as we knew it, as we knew it prior to March 13th. There certainly will be challenges. It will look different. The classroom setups will be different. Wearing masks, the much more washing of hands. Those are all going to be different. Even instruction will be a little bit different. I hope there's a day, and sooner rather than later, that we can hope that we return to a much more normal situation where there's a vaccine and where COVID is not ravaging our country as it seems to be right now. I hope that we get back to that day. And that's the day that we're all aiming for. But in the meantime, we have to prepare plans of how to educate our children. And Dr. Irvin will give you a clear description of some of the strategies that we're going to try to use. So Dr. Irvin, I will turn it over to you.
Unmute is the new don't reply all. Mr. Stingle, you can move to the next slide, please. Thanks, everybody. Thank you for joining us, and we're hoping that this presentation, while it is similar to last night's, is going to be able to answer questions, particularly for people who are not able to join us. This first slide really just reviews some important dates as reminders. Yesterday morning, we presented this plan to our faculty and staff, and then that last evening to the Board of School Directors. And then today we have this presentation. Also, as a reminder, August 8th is the deadline, the current deadline for enrollment in the Cyber Learning Academy. There is a link on our website if you want to sign your child up for that. Please complete that link. Some point in August, and this date is still to be determined, the school board will determine which reopening option the district will be utilizing for the return to school. More information again about that will be coming, and I'll talk a little bit more about what kind of factors will play into that decision and what the different options they will be choosing from, so that that's completely clear. And then August 31st is our scheduled first day for students. There's an asterisk there because we are thinking about some ways of making sure that when we bring the children back to the buildings, regardless of whether that's this fall or sometime later in the school year or whatever, that we're doing it in a way that's careful and allows us to make sure the students are fully trained and cognizant in the many changes to their school atmosphere and their interface with the building to keep them safe. Mr. Stingle, next slide, please. So thank you. A little bit about the reopening guidance then. So we have some different options depending on the conditions. And I'm going to be frank here. We're all well aware that our former green, yellow, and red designations from the state level really don't seem to be tied to any clear metrics. And that's certainly concerning, and that is a concern of the boards that they have been very public about, that we don't have governmental guidance regarding that. But in Dr. Davis's safety plan, we were required to talk about different conditions and different arrangements using designations of green, yellow, and red. So for this slide, that green, yellow, and red is not the Pennsylvania guidelines, but refers directly back to the health and safety plan. So whether or not we are able to adhere to the guidance under each of those different criteria. So the first option is full in-person education. This would be children returning to the schools 5 days a week. We'll talk a little bit more about what that would look like. The second option is a hybrid schedule. Our third option would be full remote instruction. And then in conjunction with those three, there is the option of full-time cyber learning for children who and their families who believe that this is the option that is best meets their family's needs. I want to be clear here that that the first three, in-person, hybrid, and remote, are distinct, which means that if we are in-person full day, five days a week back, the hybrid option is not available. There is not a chance for we don't feel like we can keep children safe if we would allow in-person and hybrid to operate at the same time. And I know this has been a question, like, if we're fully open, can I just send my child 2 days a week? That would not be possible. We would not be able to then manage the enrollment and the safety requirements within the classroom with different numbers of students on different days. If folks were thinking, again, if we were in hybrid and they wanted to do full remote, I mean, again, that would be the Cyber Learning Academy would be what would fulfill that need. Mr. Stingle, next slide. So let's talk about K to 12 in-person instruction. Again, as I said, this would mean students and teachers are coming to the school buildings 5 days per week. All instruction will be supplemented with a new online tool that I will talk about later. The reason why this online instructional tool is important to us is because we realize that between those three options I described, we may need to pivot between them given different conditions in the community. We also realize that some families may experience prolonged illness or the need to quarantine, and we want to make sure that where possible, students would be able to use that online tool so that they would not be losing education. They'd be able to follow along with what was going on in their classroom, even if they were home because they had to quarantine for 14 days. This option starts with a gradual return to the building, and I'll show that in detail on a next slide. And not yet though, Mr. Stingle. And as Dr. Steinhauer mentioned, we want to be clear that while the K to 12 in-person instruction option is definitely the thing that looks the most like what we would think of as our traditional pre-COVID education, it is not going to be the same. There will be universal masking. There will be changes to the student's day, like staggered arrivals and dismissals, staggered class changes to keep the number of students in the hallways at a minimum. There'll be directional signage, there'll be one-way staircases, and more importantly than that as well is there will be program modifications. Unfortunately, we are not going to be able to teach oftentimes in the ways that we are accustomed to. So for example, students gathering on the carpet for a mini lesson before a reading activity will not be allowed because of the need to maintain physical distancing. Students hovering together over a microscope to look at during a lab class, again. So we have to be clear that instruction in the classroom will also be different, and our teachers are working hard to think about how they will need to change things so that they are able to meet the standards for their classes, keep students safe. Things like phys ed, things like vocal music, again, all of these things are going to look different in an in-person instruction than they did prior to March 2020. All right, now I'm ready, Mr. Stengel. All right, so this is the staggered return to school schedule, being if we start on Monday, August 31st, where we would bring a couple of grade levels or a couple of teams into the building at a time to ensure that the students were, that the building wasn't overwhelmed with people, and that each of the teachers could then work as a team and talk their children through the different changes and things. So you can see that it will take the elementary 3 days to accomplish this. And then by Thursday, we would all be back in. The secondary is able to do this in 2 days. So again, this and I apologize for the small font on this. We will make sure that this slide deck is publicized on our website. Mr. Stingle, next slide, please. Okay, we're going to talk about the hybrid next. This is an image from the survey that we released to the community and our faculty, talking about which of the hybrid options was the most appealing. And you can see that about 60% of our community felt that the 2 days on, 3 days off, with the break in between for deep cleaning of the facilities was the preferred option. So that's what we're going to show on our next slide. So as I said, this would be 2 days in and 3 days remote. I want to talk about the fact that the remote will be synchronous and asynchronous. I'll get into this in more detail a little bit later. We would group the students into 2 groups or cohorts by family name. This way that, you know, the Davis family, for example, their children would be in school on the same days. Certainly we would be flexible when we're setting this up. We understand that not all families share the same family name. We understand that other families may have reasons for their children to be on different schedules, but in general, we would try to accommodate how we grouped those students. Again, as I said before, this instruction would be supplemented with the online tools that we'll be using. Even more important here, because while they'll be getting face-to-face in-person instruction 2 days a week, they will be working synchronously and asynchronously from home on 3 days, and so those online tools will be an important part of that education. This model also features a gradual start, and this model also features some of those, you know, many of those same significant changes to programming due to health and safety considerations. Next slide, please, Mr. Stingle. All righty, this is a visual, just sort of shows you what it looks like in terms of our cohort or student groups. So you can see in this model, student group A is coming on Monday and Tuesday and has remote learning on Thursday and Friday. Wednesday is also remote learning for the district. Other different activities may be happening online since all children will be online that day. Teachers will be available to work with their classes on those days. And this, again, provides that break between the student cohorts to deeply clean the facilities for safety reasons in between the 2 different groups of students. Next slide, please. This is our gradual start. You can see it takes a little bit longer under the hybrid model because of the way the students are grouped. So, you know, again, we would have half the students at the elementary come on the first day and the second half come on the second day. And then the next week, everybody would be back together. And the secondary is following a similar model. So it just takes a little bit longer since we don't have that Wednesday. And again, you can take a closer look at this when this is published on the web. Next, there we go. So then our third option would be full remote. This would be if we were in a circumstance where we needed to completely close the district and all students and all faculty would need to be working remotely. This again would include synchronous and asynchronous learning opportunities for students. This would be where our online instructional tools would be the most important because of the nature of this model of everyone being remote. But we do want to be clear here, if we are in this option, this is different from the Cyber Academy, so students would move to this remote with their classroom teachers and their classmates at that point. So though everything would just move from brick and mortar into the remote option. It would seem similar to how we did school at home in terms of the students went with their same, stayed with their teacher and their classmates. Next slide, please. So I do want to talk a little bit about that then, because there's some confusion between, well, how is that different from the Cyber Academy? Well, the Cyber Academy is something that you as a parent would be selecting for your family. Whereas full remote is something that the district would be declaring for all students based on the circumstances. And these things can certainly operate at the same time. So for example, if we start back in person, clearly the Cyber Academy is going to be happening. And then if later in the year the conditions are such that we need to close down and move to full remote, then basically what would be happening is everything would be the same. So all students would be learning remote. The Cyber Academy students would be staying with their Cyber Academy teacher who they had been assigned to at the beginning of the year, and the students who had been in brick and mortar would be staying with the classroom teacher that they were working with since the beginning of the year. The The interesting twist to this, and we've been thinking about this very carefully, is if for whatever reason we need to start in August with remote, we are thinking that we would probably just recommend that we start all students in remote and pause the beginning of the Cyber Academy, let all students and faculty start remote. And then when we became able to open to brick and mortar, whether that was in full or in hybrid, then we would say, okay, for folks that's not going to work for, we are going to start a Cyber Academy at this point, maybe at the end of the first 9 weeks, if that would be what would be necessary. And we would move students from there into the Cyber Academy and then remove the remaining students back to the classroom. I will be honest though, I can speak for this from the elementary. This would necessitate some students changing their teachers. Clearly the students, families who are moving to the Cyber Academy, that would be a possibility. It would also be a possibility for children moving into brick and mortar because some of our teachers will not, due to their own personal reasons, would not be able to teach in brick and mortar. They need to be remote or not, they're not able to work. So we're thinking carefully about that, and trying to make sure that whatever plan we choose mitigates any kind of changes and is making sure that we are following our philosophy of the best education possible for each and every student. And I assure you that we'll be able to do that. It is not uncommon for students to have different teachers during the course of the year. Teachers do go on different leaves for various reasons, and students are adaptable and flexible. And we believe particularly that online tool is something that will help support learning across all students, regardless of what modality they're in or who their primary instructor is. So the K-12 Cyber Learning Academy, let's talk a little bit about that for a minute. Very similar to full remote in that it is fully online. It offers synchronous and asynchronous options. The instruction is supplemented by the online tool. It is taught by Mount Lebanon faculty. I do want to share that we received many emails, probably over 200 emails, and also had 1,400 responses to the survey with lots of questions in there as well. So I'm not sure where this came from, but I did see something particularly that there was a belief that somebody was not going to have an assigned teacher in the Cyber Learning Academy. Children will have an assigned teacher. Elementary students will be assigned to an elementary classroom. Secondary students will be assigned by their periods to certified teachers to teach their courses. And Ron, I'm going to let you jump in here and fill in your piece on how faculty staffing will look like at secondary.
Certainly. Thanks, Dr. Irvin. So there's a couple of pieces I wanted to make sure families are aware of. And let me start with a little bit of background about scheduling the secondary buildings, the 2 middle schools and the high school. So one of the things that we recognize that is important to our community is the value of having a Mount Lebanon teacher deliver the instruction. Whether it is brick and mortar, the in-person instruction, or the K-12 Cyber Learning Academy, or even if we go in remote. So the ability to give us that option to have a Mount Lebanon teacher deliver the instruction to the students in those capacities, we are going to follow the bell schedules. So whether it's middle school or high school, our intent is to enroll students, no matter what option they choose. We're going to enroll them into courses that aligns to the buildings that built bell schedules. What I want to make sure that the community is aware of is that we do have finite staffing capacities. So the enrollment into the Cyber Learning Academy will dictate the amount of a teacher's schedule that it will account for. So I'm going to give you an example. So if we have 2 or 3 students that want a particular course in our course catalog, because it is our intent to deliver our full curriculum and our full course offerings. So if we only have 2 or 3 students that want a course, those 2 or 3 students will be enrolled into that teacher's course in a particular period, and then the teacher will provide the cyber instruction through an asynchronous model. And then the teacher will be available at the end of the day or through their duty period to provide that synchronous meeting time or that synchronous instruction. Because we know there's been some questions out there, particularly with the Cyber Learning Academy, about the amount of synchronous instruction. So that's one of the reasons we wanted to share that, is because That synchronous availability will occur through the teacher's duty period, or the end of the day availability. Let's say we get a few more than 2 or 3. Let's say we get 25 or 26 students interested in the same course, and we're able to schedule all of those students into the same period of the school day. Then in a teacher schedule, that will become 1/5 of their teaching period. If we can get to that level of mass, then during the instructional time, we are able to do more of a blended approach, whereby we can do the synchronous and asynchronous occurring during that academic time period into the school day. And then ultimately, if the mass gets so large in the Cyber Learning Academy, and we're able to fully release a teacher from their in-person teaching responsibilities, again, we can do the blended learning approach throughout the day with all students. So we want to make sure that the parents are aware that the schedules that are online show we wanted to show to you a couple of examples, but it is all predicated upon the amount of enrollment that is going into a particular class from the Cyber Academy, and then that enrollment as it relates to the requests for schedules will dictate how much synchronous or asynchronous instructions that will occur.
Thank you, Dr. Davis. And again, we understand what some of the questions are because we did hear several after the board meeting commentary, and so we just want to make sure that we're being perfectly plain. I want to add here that all supports for students that are offered in our brick and mortar programs, so special education, ESL services, gifted support, 504 support, all of those things will be available. And we've asked Dr. Doyle to speak about that on a later slide. So we're going to move to the next slide. And we'll get into the nitty-gritty on that in a minute. So again, a little bit more about the Cyber Learning Academy. Students who are enrolled in it are eligible to participate in after-school activities and athletics, just like our brick and mortar children are. Students who would matriculate through the Cyber Learning Academy would be receiving a Mount Lebanon School diploma. There's no cyber diploma. It is the same diploma because it is our same program. And just one little caveat about, we've had questions about students moving in between cyber and in person. And I will say, as Dr. Davis noted, this is a staffing issue as well. So we have to be cognizant of that. We are hoping that folks who are committing to the Cyber Academy are committing for the year, because it makes it very difficult for us to schedule otherwise. But should there be a situation where folks need to move in between, and we see that particularly from in-person into cyber, and students start to experience health issues or something and need to maintain, like an isolation from other folks, we recommend that where possible on the quarter, just so every, we have the 9-week grading periods, and it just is a more natural break for students to move in between classes. And even at in some of our schools, like middle school, for example, the Unified Arts rotation works on the quarter. So it makes a natural break. At the high school, we also run semester courses. So those are good opportunities for transitioning between multiple programs. And before we move off this slide, I do want to touch on something, because I want to be clear here that, while the Mount Lebanon School District is new to the world of cyber education, and we know that there are other cyber programs out there, particularly cyber charter schools. I'm just going to make a statement here where I'm going to say that while we're new at this, I can tell you that our teachers are committed. They are so interested in getting started in using the online tool, and teachers who have been interested in teaching online have been contacting us. And while I'm not going to sit here and compare us to every other cyber learning opportunity that's available to students in Pennsylvania, what I am going to say is that it is our commitment that the Mount Lebanon Cyber Learning Academy is a Mount Lebanon education provided by Mount Lebanon teachers, teaching Mount Lebanon curriculum, using Mount Lebanon resources, and providing all the supports and differentiation that Mount Lebanon students get in our programs wherever they are delivered. So that, if that's important to you, then I feel like, we will be building this, we will be learning as we are going, but we are committed to providing the best education possible for each and every student. And I just want to say that that will happen wherever we are delivering this education. Next slide, please, Chris. Okay, here I want to pause for a minute off of these options, and I want to talk to you a little bit about synchronous and asynchronous, because we want to make sure that folks are really understanding what this looks like in cyber education. because this is an important part of our hybrid, of our remote, and of our cyber learning academy. And so, as you know, synchronous means these things are existing and are occurring at the same time. And so when we are talking about synchronous learning, like we are talking about students experiencing something like what we are all experiencing right now, where there's somebody talking at you and there's a group of people on a screen, and it's real live learning. And that could be a teacher demonstrating a lab, giving a lecture on apartheid, reading a story to children, any number of things where it's happening that everybody's in the room, at the same time, while not physically, but certainly time-wise. Other synchronous options may be small groups. It might be remediation groups, enrichment groups, teachers meeting with students live who are working on a project together, or one-on-one giving them feedback about a writing assignment or those kinds of things. And another option with synchronous are office hours, where a teacher might just have a live Google Meet link from 10 to 11 while they are open, and students can drop in and ask questions, get feedback, do a little demonstration, or otherwise just touch base with their teachers. Asynchronous is obviously not existing or happening at the same time, but this doesn't mean that there isn't interaction involved or that there isn't, instruction involved. So asynchronous options include things like recorded lessons, recorded lectures, screencastifies of teachers who have recorded themselves going over a PowerPoint, much like this will turn into once this meeting is over. But it can also include things like the utilization of discussion boards and discussion groups and shared documents where students would be working on things, collaboratively through the web. So it's not just, students working at the kitchen table on a piece of paper by themselves. Asynchronous can also be interactive. It can be using different gaming tools that are providing students with immediate feedback on what they're doing. So there are some components in that built into our learning management system that I'm going to talk about on our next slide. And finally, I do want to address this piece about live stream classes. And this is a little bit of a soapbox for me. I spent 32 years in my life in education, and I'm very passionate about the teaching process. And, we've thought a lot about this when we thought about what is the best way to make sure we are delivering a quality Mount Lebanon instruction to our children. And I am here to tell you that I personally do not believe that sticking a video camera in the back of the classroom that's zooming in on the teacher and having our children, particularly our elementary children, sitting at the kitchen table staring at a Chromebook screen for 6 hours watching what's happening live in a classroom is going to be engaging, is going to be relevant, or is going to give the children what they need in terms of the best education possible. Certainly, live streaming has a role in distance education, without a doubt. And we have teachers who we are hoping are going to use it in different ways. Certainly at the secondary, there may be great ways to employ live streaming of classrooms, particularly around things like discussions or labs or things like that. But the idea of a third grader opening up their Chromebook at 8:30 and just sitting there and watching what's going on in their classroom is just not best practice. And I can tell you that there are standards around best practice for remote learning, and that is really not it. And they're using the synchronous and asynchronous options to engage students and keep their attention and make sure that we're giving them feedback and meeting their needs is what's important. I will also mention that while we were considering the use of live stream, we have engaged our solicitors on that, and we know that there are privacy concerns with that as well. Very important to the students in the classroom. To me, what's most important is whatever we're doing is what's best for students. So live streaming has a role. We are encouraging our teachers to use it where it is appropriate and where we can be sure that we are protecting all students' rights, but it is not the focus of our program, and nor do we believe should it be. Next slide, please, Chris. All righty, I get to take a break. I'm going to turn this over to Dr. Doyle, and she's going to give you a high-level overview of how we are going to provide supports for students in all of the online options, the hybrid, the full remote, and the Cyber Academy. Dr. Doyle.
Thanks, Dr. Irvin. When we are thinking about the provision of special education services during this time especially, it's important that we keep in mind the individualized nature of special education services, and that is I in IEP, in the Individualized Education Program. And especially when we're thinking of our students with more complex needs and our students with vulnerabilities. Our recovery team at every level, at the district level, building, classroom, we have been considering the needs of our students and those implications as they relate, the implications related to health and safety when it comes to in-person instruction. And we have been we have in place additional, more specialized protocols, more specialized environmental adaptations, and environmental and protective equipment to make sure that our students are safe and all of our staff members are safe. And this was referred to in the district's health and safety plan, and I just wanted to address that we know that some of our students have, we're very aware of the specialized needs and the just like when it comes to adaptive behavior and some of those things related to health, and we have to take that into consideration in our buildings and in our health and safety plan. When we look at remote instruction and remote instruction in terms of the hybrid model, also the remote model, that all should our district move to that, and then our cyber academy, we have to think about the specialized needs of our students and how our education plans, they have to be personalized to meet the needs of many of our students. When we're looking at the Cyber Learning Academy especially, that's a huge shift from a brick and mortar traditional school and having to the Cyber Learning Academy, which is in many ways like an 11th building for our district. So that being said, it's very important that we have IEP meetings for all of the students who are going into the Cyber Learning Academy. And that's what's going to happen. The case manager will be holding IEP meetings with the IEP team for every student prior to the start of instruction for the Cyber Learning Academy. This is a practice that we use when we have students who go from elementary school to middle school and middle to high school. Also, for some of our students, that's something we do when they transition from one grade level to the next, so that everyone on that team that they're moving to is aware of their needs and has an opportunity to ask questions, and we're all on the same page moving forward. For remote instruction and for hybrid instruction, should the district have those models, and even for in-person instruction, those IEP team meetings will be held as appropriate. Not all of our 700 students who receive special education services need to have an IEP team meeting moving forward in those models. But some students really do. There are important things that need to be considered moving forward. And it's important to note that IEP meetings can be held at any time. Oftentimes we think of them as being an annual event, but they can be held at the request of any IEP team member. And that's really the best way to address issues, big questions, things where we need to have a multidisciplinary team involved. And parents are the most important member of that team, other than the student, of course. So parents are certainly able to request an IEP team meeting at any time. And when looking at services, the services are all determined by the IEP team. So they're reflected in the IEP document itself. Therefore, that IEP document, whenever there's a change that is occurring with services, if it's going from, and if there's some change that's needed to take place, it has to be documented in the IEP. There has to be a revision that is in the IEP that's agreed upon by all parties of the IEP team, including the parents. There may be some revisions when we're looking at moving to the Cyber Learning Academy or even hybrid instruction, there may be some adaptations or revisions to the IEP that are necessary just because we're going from services that were written with the intention of being in the buildings to services that are taking place online. So there may be some revisions where we just need to look at the language and determine what makes sense for the student. But any of those revisions need to be documented in the IEP. Related services, things like speech and language services, occupational therapy, physical therapy, counseling, social work services, those services can be provided synchronously. So, and that would be live sessions, face-to-face sessions. Those are all common phrases used for the synchronous service delivery, or teletherapy. Sometimes that's a term that's used for speech. But that can be provided if the team feels that is the most appropriate way to provide those services. And if there may be instances where that's not most appropriate, so the team would need to look at what makes the most sense for that student remotely. But those synchronous services can be provided if the IEP team feels that it is appropriate. And speaking of the synchronous learning and synchronous services, I know that there's some sample schedules that were included in the reopening education plan. And those sample schedules really apply to, they're a general overview of what the schedule would look like for the general population. The IEP allows for individualization. So there's going to be changes and personalized learning that can be considered as part of the IEP, which may have an impact on the amount of synchronous learning time that's required. So that, for instance, if there is a small group reading intervention that a student receives, or a one-on-one session in a certain area, then that would require more synchronous time. And that's why that meeting with the IEP team, especially when we are looking at the transition to Cyber Learning Academy, is very important. So moving on to 504 service plans. The 504 service plans, those typically consist of accommodations and possibly some consultation with and some supports that are meant to level the playing field for individuals with disabilities that have 504 plans. With the 504 plans, and this actually applies to students with IEPs as well, the learning management system that we're using for our remote instruction, all of those accommodations are included within that learning system, all of the most common accommodations. And if they're not included within the learning system, then we will make those things happen. Again, with a 504 service plan, for students, for remote learning, there may be some tweaks that need to happen, some revisions, just because things look different online than they look in the building. And the 504 case manager will contact the families of the students that those apply to, those changes where those changes are needed, to have those discussions. But students will receive those accommodations regardless of the instructional environment, the instructional setting. For gifted support, the GIEP is another document that the district that we need to implement across settings. I know our teachers and our gifted coordinators, they did a lot of collaboration over the spring and were able to really put into place some great experiences for our students. For our students that were more individualized and that really that that included all the services in the IEP, and that would continue in the Cyber Learning Academy if we are in remote instruction, or if also through hybrid. But our gifted coordinators are available, and they will continue to be available to provide consultation and to our teachers, to our families, to our students. And that's regardless of the learning environment. Our English learners who receive English as a second language services, we have ESL teachers in the district that will, if we have English learners who are transitioning to the Cyber Learning Academy, ESL teachers are there to work with families and with that team to make sure that transition is seamless, and that we have everything in place to make it a successful experience for students. And those services will take place, again, regardless of the educational environment. We all are being, I was talking to one of my colleagues earlier about something that's come from all of this is we've all learned to flex the muscle that is flexibility, because we have had to learn that to just think creatively and think outside the box and do what we need to do to meet our students' needs. And we have a great team of teachers, paraprofessionals, administrators, specialists, and coordinators that we all have the same common goal: to work with our families and our students to make sure that our kids are successful.
Thank you, Dr. Doyle. Next slide, Mr. Stingle. So I want to talk a little bit right now about the curriculum then as well. And I'm not sure where everyone is in this. We talked to the board about this last night, and of course these conversations have been ongoing. But so I'm not sure where the audience is in terms of this. So I'm going to talk a little bit about the learning management system. Back on July 15th, we asked the board to approve a contract with Waterfront Learning at the Allegheny Intermediate Unit. And the purpose of that was to engage with them for their support and professional development to access a learning management program called Edgenuity. And at the time that we were in our beginning talks with them, we were looking at the Edgenuity platform for grades K through 12. And in our initial contract, that's what it appeared to be. As we had moved forward with the and started arranging the planning and the training and everything, we learned from our contacts with Waterfront Learning that Edgenuity actually had partnered with another company called Accelerate Ed, and that's where they had sourced their K-5 learning management program. So while Edgenuity has for many years offered K-6 learning management and courses, they actually didn't create their own for elementary. They contracted with another company. And Waterfront Learning was able to go directly to that other company, which is called Accelerate Ed, and access this same program directly rather than going through Edgenuity. And it has turned out to be a better arrangement for the district to do that as well then, although both options were available to us. And the main reason for that is by going directly to Accelerate, we are able to access more courses for our students. So if we would have got the K-5 program through Edgenuity, we would have had the core ELA, math, science, and social studies. By going directly to the producer of the program, Accelerate Ed, we were able to get additional programs like some coding courses, art, phys ed, and music, for example. And also, while both, all the K-12 options had the ability to be customized, we actually learned this morning, Dr. Davis and I were on a call, and we learned that the Accelerate platform has even more capacities for customizing and actually building our own courses, which is going to be useful because none of the programs offered, for example, Spanish. And as our elementary families know, we have had Spanish in grades K through 1 for many years in Mount Lebanon. So we have this, so we are now going to be using Accelerate Ed for K-5 and Edgenuity for 6 to 12. All of the courses using both of these platforms, which are very similar, are completely customizable. by Mount Lebanon, and they will be customized to match our brick and mortar programs by Mount Lebanon teachers. We actually have a group of secondary teachers who are getting trained in Edgenuity tomorrow. So we are like well on our way. We have training dates scheduled throughout the rest of the month. And it is our intention to offer the full course catalogs K through 12. I also want to make a statement about one of the reasons why we are using this is because we believe that having this learning management system, as you remember, I talked about the online curriculum tool in every one of our models, our in-person model, our hybrid model, our remote model, and our learning academy. Having this platform across all of these ensures that all students, regardless of what modality of learning they are in, are receiving the same level of education and are able to move between the different modalities with a more consistent method. Dr. Davis, I saw you turned on, so I'm thinking you want to chime in here.
Yeah, I just wanted to jump in real quick. Thanks, Dr. Irvin. To just emphasize your point about customization. We are aware that a number of community members have compared what they saw online in terms of Edgenuity's course catalog, and we're very proud of the robust curriculum and course offerings that we have inside our secondary program, both the middle schools and the high school. I just wanted to reassure the community that we do have a plan in place to offer every course in the Mount Lebanon course catalog using the Edgenuity platform. There are going to be some nice crosswalks between Edgenuity's foundational curriculum that our teachers can build from, but in the cases where those don't exist, and probably one of the most simplest examples that I can give to our community is our dance program at the high school. I don't think you're going to find dance courses in any online management system. If you do, I'd be surprised. But obviously, that's certainly a point of pride for our high school. We have the capacity to customize not only the catalog, but the content. Our teachers, as Dr. Irvin talked about, are heading through training, and we've got that additional professional development time later this month to be able to make sure that we're ready for students to receive that education in the courses that they would expect. Thanks, Dr. Irvin.
Yep. And I'll add here too, this is the third time we've given this presentation. If you noticed that from the beginning, maybe we get a little bit better every time, Dr. Davis and Dr. Doyle and I. But it did occur to me last night that I really think that this learning management system is the thing that takes these remote options and these cyber options to the next level. We understand that there were frustrations with school at home when we pivoted to what we call and what is actually referred to now as emergency remote teaching, to something that is truly online instruction. And this learning management system is really key for that. It is the support that our teachers need to deliver our program. So we want to be clear that these are tools. We are not using Edgenuity as our curriculum. We are using it as a tool to deliver our curriculum, and the same with Accelerate. All right, Mr. Stingle, next slide. So again, to talk a little bit about professional development, we've created core groups of support users. Dr. Davis's secondary folks are trained tomorrow. The elementary support users will be trained on Tuesday. We have training for all staff. As you know, we are delaying the start of school to the 31st to allow for that extra week of more training. So by having the support users in place who are going to have more time to become familiar with the platform and the customability of it, they'll be available at their building level, at their department level, at their grade level to help their colleagues and lead the work in getting these courses customized to Mount Lebanon. In addition, we want to make sure that we have some training for families. So Dr. Davis and I will be working on putting some things on the web that parents can access to help them become familiar with these tools, as well as more information just about the different options, and particularly the Cyber Academy in general. These are all things on our list to do. And we were reminded last night by one of our amazing board members that this was an omission on this slide that I didn't correct, is we will continue to provide professional development to our staff on how to be an exceptional online teacher, because it does look different from traditional teaching. We've actually already started some of that work. We had teachers were required to complete 2 courses over the summer as part of their in-service requirements for last year, because as you know, we made some changes to the calendar. So folks have already been working on how to improve their skills as online instructors, and we will continue to do that as we move forward with these initiatives. We will also be doing training around the health and safety plan, and particularly for our teachers about those expectations that they can then share with the students. Our nursing staff is going to be instrumental in that as well. And we also plan to train in some other topics. Part of our recovery work really emphasized mental health. We know that the pandemic situation, the sudden end of school, the quarantining, the inability to travel have all taken a toll on all of us. And we want to make sure our teachers are best positioned to support students' mental well-being, as well as their physical well-being and their educational well-being. And finally, the district is still committed to its diversity, equity, and inclusion initiative. And if possible, we will be adding some training around those topics as well. Did you want to jump in here, Dr. Steinhauer, or were you? Okay.
I thought this was your last slide.
I got one more, sorry,
Okay.
more. And this last slide, Mr. Stingle, is just, again, if you're looking at the plan online, we do address grading. It's important to say that we are returning to our traditional grading system. So at elementary, we will return to our standards-based grading system. At secondary, we will be returning to our letter grades and our percentages, as we have always done. And students, the grades will contribute to our GPA. Is it GPA? Go ahead, Dr. Davis. Do you want to chime in here?
No, I thought you were gonna nail it for me. Thank you. Yeah, so we are returning to percentages and letter grades, and those percentages and letter grades at the semester and year-end breaks will calculate into the students' QPA and GPA on their transcripts. So that's the piece I just wanted to emphasize. Thank you.
Yeah, I just like GPA, QPA. We don't have this at elementary land, so thank you. Again, just to add technology, as we did before, we are actually encouraging for the brick and mortar options that students bring their own. We've done this in small pockets, but we want to expand that. So families who want their children to bring technology with them so that they are not sharing devices or not using a district device, absolutely. We're working on ensuring ways to make that happen. And also to provide district devices to families that need them for support in the remote option, not just including like the Chromebooks, but also Wi-Fi devices if those are needed. The remainder of the plan really just talks about the health and safety considerations, particularly in the brick and mortar options. And then the very last section is a communication plan. And it really outlines the things that Dr. Davis started this presentation with, for example, how we will communicate with families when we have outbreaks or when we have positive cases in our buildings. And we've had an example of that today that's been pretty instructive of how we'll respond to those things. So that's it, Dr. Steinhauer, back to you.
Thank you, Dr. Urban, Dr. Davis. We will be posting both these presentations and videos, I think, from last night's presentation to the district website. The district website, if you go to it and you look for Return to School 2020-21, you will see a plethora of information. As we've mentioned, we've received a lot of feedback and comments from our families and from parents and from faculty and staff, our school board. We've tried to put as many answers to questions as we possibly can. We continue working on that on a daily basis. So I would encourage you to go back to that FAQ or go to the plan in any manner that you can get to, because that's the best way to keep up to date with information. The board has 2 meetings scheduled for August 10th and 17th. And we have, the board has made a decision that on or before August 17th, the board will decide the mode or the process by which we deliver instruction, or the processes through which we deliver instruction. We know that information from the state, the health department, emerges every day, which could change our plans. So as much as people don't like to hear it, these plans have to be adaptable, flexible, and responsive to those changes as they arrive. And we work tirelessly to make sure that we're addressing every issue as it comes up. We may get a decision from the governor or the Secretary of Health or the Secretary of Education regarding how everybody will return, and we'll have to respond to that in due time. So right now we are planning very meticulously, very diligently to make sure that in whatever mode that we come back, that we provide a quality Mount Lebanon education. I know that these are stressful times. I know that you are wrestling with, should I send my child to the cyber program, the in-school, the 5-day in, or should I be lobbying for the hybrid program? Stress is normal. We should all be very concerned about our children's education because it's very, very important. But no matter what decision you make, your child will get a good quality education from Mount Lebanon. And we will do everything possible to make sure that your children thrive both academically and socially and emotionally, and have those tools and skills they need to be successful later in life. And let's hope, and I'm optimistic, that this is a short-term transition one way or the other, and that we are able to get back to some sense of normalcy. Some of the lessons we've learned throughout this pandemic will serve us well the rest of our lives. The issues of resiliency and being able to recover quickly and to adapt. Those are life skills that will be important to us for all of our lives. Our children are looking to us and to you. If you approach this in a thoughtful, methodical, and calm manner, they too will reflect that same behavior. So I would encourage you to be concerned about it, to demand answers to questions, but also know that you have a team of educators, not just us, but your child's teachers and principals working very hard on these topics every day. And we are trying to refine them as quickly as we possibly can. So I'm asking you for a little patience. I'm asking you to trust the administrators and the educators that you've moved into this district for. We are really working hard to make sure that we bring you our best thinking all the time. So with that, I will thank everybody for coming, and please check out the district's website for up-to-date information. Thank you all for coming.